Hi, it's Dr. Sklar back to talk to you in our last of our series on are you pre, peri, or post menopause, that is. When it comes to menopause, there is no rigid medical definition, but it's generally accepted that 1 year of no menstrual periods makes you menopausal. And the word menopause comes from meno for your menses and pause, meaning hasn't happened for a while. So after a full year of no menstrual period, you have gone through the menopause transition and you are now either what's called menopausal or postmenopausal. The terminology, I admit, is confusing and you'll read different terms in different places, but menopause and postmenopause are the same thing, and it's where you'll be for the rest of your life once you have stopped having menstrual periods for 1 year. What does this mean about how you feel and what's going on hormonally? With the start of menopause, you now no longer are making estrogen and progesterone. Your testosterone level is about half of what it was previously. What we see are a number of symptoms that occur in menopausal women in the first year of menopause, and they become more severe as time goes on. The sexual issues are what I'm talking about. The vaginal dryness and loss of libido occur in the first year after menopause in about 42% of women. And by 8 years in menopause, almost 80% of women are having these sexual problems. What else happens? Well, frequently with the lack of estrogen, women experience hot flashes or hot flushes. What are these? These can be either brief episodes of feeling warm, which then subside spontaneously. In some women, they last for 5 minutes. Unfortunately, in other women, they may last a half hour. They may be accompanied by profuse sweating, turning red, having dizziness or palpitations. All of these things are representing what are called hot flashes. If they occur at night, they can be very disruptive to sleep, creating insomnia problems that make you feel very fatigued the next day. And if they're occurring and are severe in the daytime, they can really interfere with your work and family life. So as you can see, menopause is a time of tremendous change. Now, will these things continue? It's very difficult to say. The average term of hot flashes is said to be 2 to 5 years, but there are many women who persist in having hot flashes lifelong unless they are treated. What can you do about the symptoms that you have in menopause? My perspective is that being on a balanced hormone program will help your menopause symptoms and will help ease you through the transition that I've discussed with you from pre to peri to postmenopause.